I'm going to be assessing this patient. I'm going to start with assessing your grip strength. Okay, can you squeeze, 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 squeeze? Great. So my patient's hand grip strength is 5 out of 5. I'm now going to be doing her elbow range of motion, her passive range of motion for her elbows. I'm going to flexation, extension. Okay, now I'm going to be checking for my patient's bicep and tricep strength. I'm going to have you do this for me. I'm going to pull, don't let me pull, don't let me push. Good. My patient's bicep and tricep strength is 5 out of 5. Now I'm going to be doing her range, her passive range of motion over her shoulder. I'm going to do flexation, extension, adduction, internal rotation, external rotation, flexation, extension, adduction, internal rotation, external rotation. Okay. Now I'm gonna have check my patient's cerebellum, and I'm gonna have her use your thumb and touch all your fingers as fast as you can. Okay. Now I just need you to put your hand on your thighs and just flip flop as fast as you can. Okay. So my patient's cerebellum is intact. Next, I'm going to be checking my patient's DRT. I'm going to start with her bicep. I'm going to have her relax. Okay. Good contraction of her bicep and her left arm. I'm going to have her relax. Good contraction of her bicep and her left arm. And I'm going to do her patella. I'm going to have my patient relax her legs, relax, relax. Okay. Okay, good contraction of her patella. Good contraction of her patella. I'm going to do her Achilles. I'm going to dorsiflex her leg. I'm going to dorsiflex her leg and use the back of my hammer and hit her, the back of her feet. Okay, no pantation. No rotation. Okay, I'm going to have my patient lay down. I'm going to be auscultating my patient's abdomen for bowel sounds. I'm going to start in the right lower quadrant, right upper quadrant, left upper, left lower. Now I'm going to auscultate for the to make sure there's no bruise. My patient's bowel sounds were all normal. I'm going to start with the aorta, which is midline and below the xiphoid process. The right renal, which is above the umbilicus to the right. The left renal, which is above the umbilicus to the left. The left iliac, which is below the umbilicus to the left. And the right iliac below the umbilicus to the right. There's no bruise noted. Okay. Now I'm going to be percussing my patient's abdomen, starting with the right lower quadrant, checking for tympanic dullness. Okay, normal percussion sounds. Now I'm going to be soft palpating my patient's belly. Do you feel any pain?
No.
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 No tenderness or mass noted. Now I'm going to be palpating for my patient's liver. I'm going to put my left hand underneath her, and then using my right hand, I'm going to find the vertebral angle, and I'm going to palpate down while my patient takes a deep breath. Can you take a deep breath, please? Okay, I did not feel her liver, which is a normal exam. I'm going to have my patient turn over towards me. Bend your knees, lift your arm, and I'm going to put my left hand underneath her again, and I'm going to use my right hand to find the corostovertebral angle, and I'm gonna push down and ask my patient to take a deep breath. Okay, I did not feel her spleen. That was a good exam. Patient's spleen is not enlarged. Now I'm going to be doing the flexation of her hip. I am going to ask my patient to bend your knees. That's flexation. I'm going to have her straighten out her legs. Then I'm going to do abduction, adduction. I'm going to do internal rotation, external rotation. Okay, abduction, adduction, internal rotation, external rotation. Perfect. Now I'm going to check my patient's knee rate, passive range of motion. I'm going to have her bend her knees, which is flexation. Then I'm going to have her straighten out her leg, which is extension. And now I'm going to check for the strength in her legs. Okay, I'm going to push, don't let me push. Okay, my patient's knee strength was 5 out of 5. Now I'm going to check her passive range of motion of her ankles. I am going to do dorsiflexion, plantarflexion, and rotation. Dorsiflexion, plantarflexion, and rotation. Now I'm going to check the strength of her ankles. I'm going to push up and do dorsiflexion against resistance, and plantarflexion against resistance, dorsiflexion against resistance, plantarflexion against resistance. Okay, my patient's ankles was 5 out of 5. Now I'm going to have my patient stand up for me. Okay, I'm gonna test my patient's active spinal range of motion. I'm gonna have her touch her toes. Okay, that was flexation. Extension, I'm going to have her lean back as far as she can. Okay, now I'm going to do lateral flexation, which is going side to side. Okay, and now I'm going to check for rotation, just switch side to side. Okay, the last exam I'm going to do is the lumbar test. I'm going to have my patient move forward, and I'm going to have her close her eyes, and I'm going to check for any swaying or any balance issues for 20 seconds. Okay, that is it. My patient passed her lumbar test, and that concludes my assessment.